when KHI started getting to know about OpenAI and artificial intelligence coming, it's like the whole hype, we started wondering, where is public health? How can this particular technology support public health? And it's been relatively new. About 3 years ago, we started talking about it, but it seemed like, as looking around, we didn't identify any particular efforts going on developing a resource for public health organizations, how they can tackle, how can they make sense out of it. And so our team decided that it could be really valuable to have, under the public health infrastructure grant, some kind of consistent and comprehensive guidance that the grantees can use to develop their AI policy, develop their AI guidelines, so they can safely experiment with AI technologies for their work. In the development of the toolkit itself, we started with learning a lot about what other policies existed at the state level, what literature is about the best practices on developing your AI policies. But most importantly, it was really hearing from PHIG grantees of what their needs are and how this policy should interact with other policies in their departments. So actually, Public Health Infrastructure Grant allowed us to do the workshops to build capacity and literacy on AI, and through those workshops, we were able to gather this information that ultimately also informed the actual production of the toolkit. So we were able to make sure that the content of the toolkit is reflective of the needs. For example, the toolkit has about how you build rationale around the use of AI. And so because we don't want to just jump to AI, we want to have a solid reason why we're using that technology and not something else. The Public Health Infrastructure Grant has been instrumental in helping us to work with partners, specifically with Wichita State University Community Engagement Institute and Health Resources and Action Team, to build capacity of PHIG grantees in AI. So over that period of time, we were able to conduct over 40 workshops that reached ultimately more than 5,000 people. And that, I believe, is a tremendous success of being reached the PHIG community and being able to work directly to build their capacity and comfort with using AI in an ethical way. Artificial intelligence can be very powerful. It can help with predictive analytics. It can help to analyze massive data and much quicker, so public health can respond quicker to emerging needs. And I think being really grasping how to do it best can help public health to be very powerful. But in order to do that, we need public-private partnerships. We need public health to connect with private sector and private sector work with public health. We need to also figure out how to incorporate AI in the data modernization efforts more effectively. And we need to figure out how we can support health departments in their capacity building, having use cases, list sharing. One thing that we have learned from the workshops, that there is some innovation happening in different places, but we don't necessarily all know what that looks like. So for example, we heard some departments using Pocket Talk, which is an AI tool that helps with translation in multiple languages. And it would be good to capture those use cases and share it with other departments of lessons learned and how it can be implemented. It's important to realize that it seems that AI is here to stay. AI is not going anywhere. We've seen tools that are consistently embedding AI, even the tools that hasn't had AI before. And so I think it's important to remember that if we're not using AI, it doesn't mean it's going to go away. So it's here, and we need to figure out how to leverage it in a way that can really support the work we're doing in public health. And the great news is that Public Health Infrastructure Grant has that capacity and has experts and has that a part of the work that they're doing that can really support grantees.